Okay, so let's go over the Humira and what's in it. So this will be, I guess the dosage you're getting is the same, the 40 milligrams. So you get this box, there's 2 pens in here. And you open it up, so there's some instructions in here, but pretty simple. So you get 1 pen, a bunch of instruction manuals, and 2 alcohol swabs. I'll show you what those are for in a sec. And another pen. So this is just all product guides and stuff that you don't need. Same thing for this, these instructions. You really don't need those. Although it does say you can poke yourself in the stomach if you want. So you get 2 of these pens. They come refrigerated. I don't know if you'll have to go to the pharmacy and get them. Mine come shipped to me, and they come in a box with dry ice. Well, it used to come with dry ice, now they just come with ice packs, but they have to be kept in the refrigerator. And then typically I will take them out of the refrigerator probably a couple hours before I'm going to take them, just because it stings a little bit when it's really, really cold when you put it in. So I'll open one of these. So you just peel off the back. Off the side. The plastic is just recyclable. So this is what the pen looks like. As you can see, there's no nothing too much to it. So this cap, this purple cap, covers the injection mechanism, the trigger. And this side is that you put up against your skin to get the shot. And as you can see, there's no needle to be seen or anything like that. And then this is the end that you're just gonna push with your thumb to do the injection. There's a little window here to show you the vial, to show you how much is in there. I guess it's just so that you can see there's something in there before you give it to yourself. Right, so you can take these, when you undo it, you can just put these back on if you don't need them. But that's pretty much it for the pen, window and the 2 ends. So I'll show you what I do to take them. It's not a big deal. So I have one of the alcohol pads and one of the pens. I took the other alcohol pad and pen and put them back in the fridge for 2 weeks from now. So we'll just work with these. So first you can take one of the alcohol pads and clean the area that you're going to give yourself the injection. You want to do it in a different place each time. I didn't know that, and I just gave myself, for like the first 2 years, a shot every 2 weeks in the same spot, which, I mean, it didn't hurt, it didn't do anything, but they want you to do it in different places. So now I do like a shot in my upper right thigh, then my upper left thigh, then my lower right thigh and lower left thigh. So it takes like 2 months before I get back to the same spot again. You want to make sure to not bend your leg straight like this, so it's straight across the floor and your leg is straight down with like 90 degrees like this. Even if you're totally relaxed, it makes the muscle much tighter, so it's hard to grab to get to bunch up the area to give yourself a shot. I also didn't even realize you were supposed to do that either. I used to just give myself a shot straight in the so it was going like right into the muscle. And you get used to it, so that really didn't even bother me, but it's much better now. So you want to keep your leg pretty much kind of straight at an angle down to the floor and relaxed, and then you can see you can grab much more, much more of the leg muscle that way. So this week I'm doing upper right thigh. So just open this, and just a tiny little alcohol pad, because it's all you really need. They just want you to clean the area a little bit. So just wipe it down a little bit. I just do like a little 2x2 inch area. So it's going to be the spot. And then you just want to grab that in that area that you just got. You want to puff up a little bit between your fingers so that you can give yourself the shot there. So you just take the pen, take the cap for the trigger, put it aside, take the other cap off the other end, puff up that spot that we did. You want to put this as close as you can to perpendicular to your leg, straight up and down, right? The more straight up and down you can do it, the less you'll feel it when you give yourself the shot, and it won't bleed as much after. You'll see it doesn't bleed that much anyway. So you just push with your thumb on the trigger, and it gives yourself the injection. Just wait for a couple of seconds, and you'll hear at the end, it already did it, so, but I'm just not moving it for the time being. You'll hear at the end when it's done, it makes like a little psst noise, which just means it's released the last bit and it's got a little puff of air, so you'll know when it's done. It only takes about 2 seconds. And just pull it straight back up again. And I'll let you see what I was talking about. So then I just put the trigger cap back on, and I put the cap on the other end. You can still see there's no needle to be seen or anything like that to worry about getting stuck by. Put the other cap on. So you can see I probably didn't get it exactly 90 degrees because I was trying to film and do it at the same time. You can see there's like a little tiny drop of blood right there. But that's really, you know, pretty much the worst that you're ever going to see of it. You just want to make sure you put it perpendicular. You press the trigger, make sure that you just let it finish, and then pick it straight back up again, and then it should be fine. And I just used the alcohol wipe and get that little bit off of there, and that's it, and you're done. So it only takes a second. It doesn't really hurt at all. You know, the first time you do it, the little pushing the trigger might startle you a little bit or something, just because it makes that little, you know, clicking noise when it happens. But after you do it the first like 1 or 2 times, it's not a big deal anymore after that, and you'll get used to it. So key things, like I said, make sure that your leg is not bent like this. Even if you're relaxed and your leg is you know, your leg is up straight like this, it's going to be tight, and it's going to be hard to, you know, pinch up some skin to put the shot into. And the more that you can pinch it up when you give yourself the shot, the less you're going to feel it. If you shoot it straight into your muscle, which is what I used to do at the beginning, because I didn't know, I would just put it on and into the muscle. I don't want to say that's painful, but it's certainly, you can feel it more than if you're doing it where your leg is down and you're just relaxed and you pinch some stuff up, you barely even feel it at all. I hope this helps. You can ask me any other questions you want about it, and let me know. Talk to you later.